Hi, I'm Garvin. This telecast is on EllaOne. So EllaOne is an emergency contraceptive intended to prevent pregnancy after unprotected sex or if your contraceptive method has failed. For example, if you had sex without protection, if your partner's condom tore, slipped or came off, or if you forgot to use one, or if you did not take your contraceptive pill as recommended. You should take EllaOne as soon as possible after sex and within a maximum of 5 days. This is because the sperm can survive up to 5 days in your body after intercourse. EllaOne is suitable for any woman of childbearing age, including adolescents. You can take EllaOne at any time in the menstrual cycle. However, EllaOne does not work if you are already pregnant. If your menstrual period is late, there is a possibility that you may be pregnant. When your period is late or when you have symptoms of pregnancy such as heavy breasts or morning sickness, you should consult a doctor or other healthcare professional before taking EllaOne. If you have unprotected sex after taking EllaOne, it will not stop you from becoming pregnant. Unprotected sex at any time during your cycle can lead to pregnancy. EllaOne is a contraceptive used to prevent pregnancy from starting. If you are already pregnant, it will not interrupt an existing pregnancy. EllaOne is not to be used for regular contraception. If you do not have a regular method of contraception, talk to your doctor or other healthcare professional to choose one that is suitable for you. EllaOne contains the substance Ulipristal acetate, which acts by modifying the activity of the natural hormone progesterone, which is necessary for ovulation to occur. As a result, EllaOne works by postponing ovulation. Emergency contraception is not effective in every case. Of 100 women who take EllaOne, approximately 2 will become pregnant. Emergency contraception does not protect against sexually transmitted infections. EllaOne is available as a 30mg tablet. Take 1 tablet by mouth as soon as possible and no later than 5 days after unprotected sex or contraceptive failure. Take the tablet without delay. You can take EllaOne at any time in your cycle. You can take EllaOne at any time of day, either before, during or after a meal. If you vomit within 3 hours of taking the tablet, take another tablet as soon as possible. If you have unprotected sex after taking EllaOne, it will not stop you from becoming pregnant. After you take EllaOne and until your next period, you should use condoms every time you have sex. After taking EllaOne, it is normal for your next period to be a few days late. However, if your period is more than 7 days late, if it is unusually light or unusually heavy, or if you experience symptoms such as stomach pain, breast tenderness, vomiting or nausea, you may be pregnant. You should do a pregnancy test right away. If you are pregnant, it is important that you see your doctor or other healthcare professional. If you take more EllaOne than you should, don't worry, no reports of harmful effects from taking a higher dose than recommended. However, do ask your pharmacist, doctor or other healthcare professional for advice. If you have any questions, first of all, the side effects. Possible side effects include nausea, vomiting, painful periods, breast tenderness, headache or back pain. Do not take EllaOne if you are allergic to Ulipristal acetate. Talk to your pharmacist, doctor or other healthcare professional before taking EllaOne if your period is late or you have symptoms of pregnancy, if you suffer from severe asthma or if you suffer from severe liver disease. Tell your pharmacist, doctor or other healthcare professional if you are taking or have recently taken any other medicines, including medicines obtained without a prescription or herbal medicines, if you're using one of the medicines that may prevent EllaOne from working properly, or if you have used one of these medicines in the past 4 weeks. EllaOne may work less effectively for you. Do not use EllaOne together with another emergency contraceptive pill that contains levonorgestrel. By taking them both together, you might make EllaOne less effective. Speak to your doctor or pharmacist before using EllaOne. In the past 4 weeks, if you have taken medicines used to treat epilepsy, TB, HIV, fungal infections or herbal remedies containing St. John's wort, then EllaOne may be less suitable for you. Your doctor may prescribe another type of emergency contraceptive, such as the copper intrauterine device. If you take EllaOne while you're breastfeeding a baby, do not breastfeed for 1 week after taking EllaOne. During this time, it is recommended to use a breast pump in order to maintain milk production. But throw away your breast milk. After taking EllaOne, some women experience dizziness, drowsiness, blurred vision, and loss of concentration. If you experience these symptoms, do not drive or use machines. So if you have any further questions on the use of this medicine, you can ask me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.